Good afternoon, everybody. My name is Chachi Angelo. I'm the Director of External Affairs. I'll be moderating this webinar today. This is our open enrollment 2026 kickoff call. And as you can see on our agenda, we're first going to hear from our Executive Director, Devin Trolley, and we're going to be rolling through some new federal policies and what they mean for our program. New system features that we want you to be aware of, giving you an update on our Pennie customer service, our call center, and some application updates we want you to be aware of. And then we'll be getting into our communications plan, our stakeholder toolkit, which you can use to help get the word out about open enrollment, and then an update on our new assister network and our outreach plan. And then, like I said, if you have a question, and you want to drop that into the Q&A feature, we'll be monitoring that throughout the call. And if it's timely, if it's hitting the topic that we're on, we'll try to answer that right away. But if it can save till the end, then we can address some questions there at the end too. So without further ado, I'll pass it over to our Executive Director for Pennie, Devin Trolley. Go ahead, Devin. Take it away.
Thanks, Chachi, and thank you everyone for being here today for our open enrollment kickoff call. I just wanted to start off on a high note and note that we have record enrollment, and what an achievement that's been to hit that for Pennsylvania, in large part due to all the work that you all do every day to work with people who are looking for coverage and to help people throughout that process, provide information about Pennie. It's really that work that has allowed us to, again, reach record levels of enrollment across Pennsylvania, nearly 500,000 enrollees. And, when we talk about enrollment, it's not just the number. It's, as you all know very well, each person behind that number that has a peace of mind that when they need to go to the doctor, they can, and when they get sick or injured, they don't have to go bankrupt because of it. So again, thank you for all of the work. For those of you who have been working with this program for a long time, I'm sure you feel that just like we do, just the amount of how great it is to see this program really kind of fulfill its goals of providing affordable, high quality coverage for Pennsylvanians. So that being said, as we look forward, we have a lot of change on the horizon, and wanted to talk a little bit about that and sort of how we're thinking about that over the coming weeks. Having worked in this program since the very beginning, back in 2013 when the marketplaces kicked off, I have to say this year is pretty unprecedented in the level of uncertainty we have. Very uncharted levels of uncertainty, as we all know and are hearing, as we speak, just weeks away from open enrollment, that Congress at the federal level is still sort of debating the very consequential policy of whether to extend the enhanced tax credits or not. We're reading the news just like all of you, so we do not know what will happen, but we are sort of anxiously awaiting resolution on that front. And what we are seeing is that there is a possibility that there might be a change to federal policy, there might be an extension of some kind, but that policy may come very late, much later than all of us would be looking for that to happen. Throughout these changes and potential late-breaking changes, our commitment to you is open communication. As soon as we have updates from the federal side on what policy changes might be occurring, especially around the enhanced tax credits, we are committed to making sure that all of our stakeholders, all of our partners, anyone working with consumers has as much information as quickly as possible. We will try to make that quick, but there are also some things depending on what changes and when. It will take us a minute to kind of figure out what our response to that will be and how we can communicate those changes and maybe change processes to get those updates to consumers. So asking both for a little bit of patience, but also making the commitment that we will communicate as broadly and as widely and as openly as we can as soon as we have a plan if there are late-breaking changes, because we really want to emphasize helping consumers navigate those changes, minimizing disruption to the extent possible. And I think that's going to be the challenge for all of us. As if the enhanced tax credits are not extended, there's going to be a lot of consumer confusion and questions. And if they are extended, that would be great, but given where we are on the calendar, that's probably also going to cause some confusion. So we're all kind of going to be in this together over the next couple of months of trying to figure out the best way to, for people who have coverage, keep them in coverage, and for people who are looking for coverage, get them the information that they need to enroll. So just to talk a minute about sort of the two paths ahead of us. Without congressional action, that means the enhanced tax credits would expire for 2026 coverage. So when we open our doors on November 1st, it would reflect those higher costs that people would pay because of the lower federal help, the lower federal financial help. This on average will mean costs will go up about 80% for enrollees, and they will be receiving information about what they will pay in 2026 in just a few weeks with those eligibility and auto renewal notices. Unfortunately, we do anticipate that with these increased costs, up to 150,000 Pennsylvanians, or about a third of our enrollees, would be in the difficult position of having to drop coverage because they can no longer afford it. So we are, again, trying to provide as much information as possible to those individuals. We've already been communicating a lot with Pennie enrollees about the potential for this to happen. On the other path, with congressional action, depending on when that comes in, well, again, while it would be great if it keeps in place the key affordability, it could also cause major disruption, again, purely from communications, operational, renewal, open enrollment, all of those perspectives that are, again, starting in just a couple of weeks here. So if we do get action, again, we will pivot as quickly as we possibly can. And then as soon as we have information to share, we will be sharing that. We are going to prioritize shielding consumers from confusing or conflicting information as much as we can, kind of understanding that depending on if there is action, when that action happens, that will be unavoidable in some scenarios. So we really want to approach this with communicating far and wide, over communicating with all of you and our other partners and stakeholders, and hoping that you will do the same with the people that you're working with, again, to help consumers navigate lots of potential turmoil. So kind of regardless of all of that, we have some goals for this open enrollment that we think work in any scenario. One is that we really want every single person to come in and update their application. There are a couple of really important reasons for this. The first is that there are new higher federal penalties if people's income is not up to date. So if they project their income from next year, have a big change, and they don't update that quickly enough, that could mean higher penalties in terms of having to pay back all of the tax credits they got that were sort of misaligned to whatever income change they had. Another thing to keep in mind is that 2 years from now, under the new law passed this summer, we won't be able to automatically renew people unless they've made an update. So we want people to practice that now. We want people to practice coming in every single open enrollment and updating their information. We also want everyone to shop. Plans and prices change every year, whether the enhanced tax credits are extended in their exact same form or not. Even in that scenario, there will be plan changes, price changes. And so we just think it's so imperative, whether there's a lot of coverage disruption or even less, we still want people to come in and look at their options and make sure they still have what works best for them. And again, as I mentioned before, we really just want to over communicate with everyone trying to navigate this process over the next couple of months. A few other pieces that I'll highlight. A few things that we're going to focus on in our messaging and communication with consumers is on value and quality. As prices go up, people might be looking at other options for coverage that may not have all of the protections, the maximum consumer protections that you can get through Pennie. So emphasizing the 10 essential health benefits, the annual limits on lifetime or annual maximums, and how insurers can't put those in place. Things like that, that when people are sort of looking at the amount they have to pay every month and asking, what do I really get for that? Making sure we are there to remind people of those valuable aspects of coverage. The free preventive care is another one. Our team did some great consumer research over the past year that showed that there is still a lot of confusion and sort of people don't necessarily know all the pieces that they are getting with their coverage. So I think this open enrollment especially is a really important opportunity to highlight all those pieces of value. We can also emphasize that even if the enhanced tax credits go away and we revert back to sort of those original premium tax credits, at that time, 4 out of 5 people still did qualify for enhanced tax credits. And this is really a message for sort of the uninsured. And, if the enhanced tax credits are not in place, coverage will be more expensive than it is right now. But many people, especially in more limited income ranges, would still qualify for tax credits. So I think there's still an important message there. And throughout all of this, top line message for consumers, pay attention to every single thing coming from Pennie or from the insurance companies and from all of you, just because that's how they're going to know what to do to navigate any changes that are coming. And as a reminder, many of you serve in these roles, that free help is available across the Commonwealth for people who want to get help locally or virtually or by calling our helpline. We have many different ways for people to get answers. And I think collectively, as I mentioned, really it's about staying nimble and staying flexible over the next couple of weeks and couple of months as meter changes might come through, or maybe not. Either way, just really trying to focus on making sure that we can give consumers the most accurate information we can as quickly as we can. That's our commitment to you, and we hope that you will also help us with that in communicating to consumers. So here's to open enrollment 2026, which is, I think, going to go down in the books as one of the more eventful ones. And with that, I will turn it back to Chachi.
Thanks, Devin. Just wanted to, if you want to stay right there, we did get a question from Donna of, well, first off, we will be sharing the recording and the slides that we're presenting today. But Donna had a good question around if the APTC is extended, how quickly can Pennie, be ready to reflect those enhanced tax credits?
Yeah, that's a great question, and one that we are honestly reevaluating every day that ticks by on the calendar, because we did really try to convey that September 30th was a really important date for us to be able to update our system and our auto renewals with an enhanced tax credits continuing. We are a week past that date. So at this point, we are on very, very tight timelines. And if we receive word of an extension today, I mean, we could probably turn that around in both online and renewals. But every day that goes by, I would frame it as there's an increased likelihood that we will have to push back timelines on renewals or other pieces of information that we're sending to consumers. And if we're talking about a very, very late October extension, that could end up impacting open enrollment and the start of open enrollment. Again, it really depends even down to the exact day that we get word from that there is an extension of our ability to pivot on that. We are trying to stay very nimble on that, but there are certain realities of how long it takes to update the system to run everyone's information through. And certainly if it's not a straight extension, but some variation where they're adding policy changes to the income levels that qualify or other things, that will take a bit longer as well.
Thank you. And I saw there's some questions in there really around the recent federal policy changes. So to talk about the federal policy changes, I'll pass it over to Pennie's Director of Policy, David Thompson.
Thanks, Chachi and Devin. So in addition to obviously the congressional debate, we'll say, over extending the enhanced premium tax credits, there are a number of new federal policies that have come into effect or will be starting January 1st. So between HR 1, or the One Big Beautiful Bill, and the 2025 Marketplace Integrity and Affordability Final Rule, there have been a number of policies signed into law, as well as enforced through regulation. And of course, we have an injunction. So we've been parsing through this for months. So really, for 2026, what it comes down to are these changes that affect us going into either right now or going into open enrollment. So the first one, the biggest thing starting January 1st, is that individuals who are lawfully present but who do not meet the 5-year bar, who are under 100% of the federal poverty level, will no longer be eligible for financial savings. So up until now, these individuals were eligible for tax credits and cost sharing reductions as if their income was exactly 100% of the federal poverty level, because they are categorically ineligible for Medicaid or CHIP, or for Medicaid rather, due to their immigration status. That is changing. So immigrants, people who people who don't meet the 5-year bar, unfortunately, no longer eligible for financial savings through Pennie. There are potentially other options. Obviously, They can enroll in the QHP through us, but unfortunately not with the financial savings, and they'll still be ineligible for Medicaid. And then the 3 changes that have already gone into effect, but will be felt throughout 2026. We've had a low income special enrollment period for individuals in households under 150% of the federal poverty level. That's been available on a monthly basis. That has been removed effective last month. So people who have the special enrollment period open for them are still able to enroll. However, no new folks will be able to enroll using this SEP. It's effectively been removed from our system. DACA recipients have seen their eligibility flip-flop this year. New for 2025, DACA recipients for the first time became eligible for QHP with financial savings. However, effective last month as well, they are no longer eligible for coverage. So unfortunately, that was short-lived eligibility for them. That has already been processed, and no new DACA recipients can come in, unfortunately, to enroll into Pennie coverage. Next, this is a more subtle change, but one that you might be seeing with your customers. Customers with an income data matching issue, or DMI, will no longer have 150 days to verify their information. They will go back to the standard 90 days to verify their income. So that is a change there. It's in line with our other data matching issues. So those are the big federal changes. In the last few weeks, there have also been new rules, new guidance from CMS as it relates to hardship exemptions for folks to be able to shop for catastrophic plans. As you know, we have gold, silver, and bronze, and sometimes platinum metal level plans. Catastrophic plans are generally available for individuals under age 30, and then certain in the past, or up till now, really, individuals with certain hardships, such as maybe unable to pay for a utility bill or spend time in a homeless shelter, things like that. Those were types of hardships that one could use to qualify to shop for a catastrophic plan. CMS guidance has expanded that criteria greatly to allow individuals in households with income under 100% FPL and over 250% FPL shop for catastrophic plans. So what people must do, and what we've updated our FAQs to reflect, is that healthcare.gov has a hardship exemption form. Individuals must fill out that form, submit it through healthcare.gov, and then they'll get a postal mail notice with a number that they can then put into our application in order to be able to shop for catastrophic plans. With the caveats that we encourage people to look at all of their options before choosing a catastrophic plan. But for those who fall into the new criteria, this is a potential pathway for them. Next slide. And then, as Devin mentioned, as of today, Congress has not extended the enhanced premium tax credits. We have, and all of you have, we've been beating the drum on the impact of not extending these tax credits, the impact that will have on Pennsylvanians, on Pennie customers. Right now, an extension will cause significant operational disruption, maybe consumer confusion. As Devin discussed, we're doing everything, whatever's going on right now, we're doing everything we can to have a consistent message about what the reality is today and what customers are eligible for today. That'll be the same throughout renewals and open enrollment until we have a final answer on what Congress is going to do. So if Congress were to extend the tax credits, that would impact open enrollment. It could delay auto renewals, but as of today, we don't have that extension, so we're moving forward as such. If you were with us in 2021, you know when the enhanced premium tax credits were first implemented, you'll know that as soon as we have the opportunity to get benefits to people, we're going to move heaven and earth to do so, but in a way that minimizes confusion and potentially, operational issues on our side. So it'll be an all hands on deck approach across the organization and with all of you to ensure that our customers understand what's going on and, potentially, the benefits being restored. We'll be on top of it in terms of communicating with you, but also with our customers. We've been planning for this all year. Any scenario that happens, we'll be ready. And that requires us to be flexible and responsive across the board. And as always, we will be. All right. See some hands. I don't see the chat. Chachi, I don't know if there are questions we want to address now or if we want to keep going.
Yeah, that's a good point. We did see one, and maybe you have some insight on this, is how long with healthcare.gov is normally a hardship code take to process? Do you have any estimate of time on that?
Yeah, so the timeline I think we don't know exactly because right now we just don't get a ton of them. But according to healthcare.gov, it takes about 30 days to process a hardship exemption form. And so, requires the consumer to pull down the form, mail it. They got to mail it, and then they'll get a postal mail response back. So while the path is much wider now for people to qualify to shop for a catastrophic plan, there is a waited period. So I think, in that time, people should use that to shop around for their other plans. And if they decide that, hey, I can't afford anything else, this is my only option, then I think maybe maybe that could be the route to go. But it is a significant amount of time.
And then I saw a couple questions asking for you to expand on individuals who qualify for the above 250% hardship exemption. Any other context that you could add there?
Yeah, so thank you. I appreciate the question. The guidance says not eligible for APTC or eligible for cost sharing reduction. So that's where the over 250% FPL comes through. As you know, only individuals between 100% FPL and 250% FPL are eligible for cost sharing reductions. So anything above 250, not eligible. So that's really where I would say the big expansion is. I would say I would encourage people just above to still look at their options, whether the enhanced premium tax credits are extended or not. They're still likely to qualify for some form of financial help, which you cannot get through a catastrophic plan. But that's kind of how try to look at this as simply as possible. If you have those incomes above 250, under 100, then you might qualify for a hardship exemption.
For those of you that have your hands raised, I think it'll be easier if you just drop your question over into the Q&A. It just saves a whole lot of technical clicking with as we go through and just trying to stay on time. So please, with those that have your hands raised, go ahead and drop your question over into the Q&A, and we'll keep things going with some new system updates. I'm going to pass it off to Eric Hewitt.
Good afternoon, everybody. We just wanted to provide some insight into some new system enhancements that will be coming to Pennie.com as you do shopping this year for your clients and customers. Moving forward. So the one I'm going to be speaking directly to is the new feature for simplified plan view. You may have remembered if you attend board meetings or listen to Pennie board meetings, the board approved a simplified plan shopping view, which limits the number of plans directly shown to customers as they enter into the plan shopping experience. So when customers get into plan shopping, they will first see the new simplified plan view. It is the default view within the system going forward. Each insurer has provided a set of plans to Pennie that is displayed within the plan view this year. The rules approved by the board of directors is no more than 15 plans per insurer per county. This is by parent companies, so those companies that may have multiple company names within a single county, they would still be limited to 1 to 15 plans for that entire parent company. So the parent company being Highmark or Independence or Ambetter would be only allowed 15 plans for all of their offerings. There would be no more than 6 plans in a meta level. So out of those 15, you can only have a maximum of 6 plans per meta level. You must the insurers must include the lowest cost plan they offer in each meta level. So you'll see 1 plan will be the lowest cost plan, and then the rest of the plans within the meta level can be at the insurer's discretion or choice. Customers will have the ability to always toggle out of the simplified plan view and see all of the plans that are being offered within their county. But the idea behind this new initiative and this program is to ensure that customers are able to see a fewer number of plans going into plan shopping. We have been getting feedback that customers feel sometimes overwhelmed or that there's too many choices. So this kind of narrows that down to the top plans insurers would like or think that customers might benefit most from. All of the same filtering options are still available to customers. The same algorithms that were used previously will continue to be applied to the customer's filtering choices. That is still driven by the customer. They will just be applied initially to the simplified plans chosen by the insurers. And then after that, if the customer moves into the all plans, they'll then again be applied. Looking at the screen, you'll see an example of what this will look like. You'll have this purple banner here explaining what the simplified plan view is. And you can easily click out of it by clicking the X next to the simplified plan shopping. If you'd like to get back into simplified plan view, you just go over into the filters like you normally would and filter by simplified plan view. And those plans will be this simplified plan filter will be reapplied. I'm going to now hand it over back to, I think, David, who is going to continue going into some additional enhancements that you'll be seeing in the Pennie system going into this year.
Thank you, Eric. Another new feature that we are very excited about is we are adding a secondary income data source from the Pennsylvania Department of Labor and Industry. Each quarter, they receive quarterly wage data from Pennsylvania employers that cover the vast majority of employees within the Commonwealth. So we believe that this data is going to give us more recent data than the tax return data we receive from the IRS to verify customer income. Our partnership with labor industry will provide us with multiple opportunities to automatically verify customer income. So what's going to happen is we have essentially the quarterly wage data from the Department of Labor and Industry. So as we go into auto renewals, we will ping our current customers against the IRS database if there is a income data matching issue. instead of automatically raising a DMI in our system, we will be utilizing this quarterly wage data to see if we can automatically verify customer income, without the customer having to take any action on the DMI. So we're very excited about this. So we're going to be using this for open enrollment. This will reduce the number of income data matching issues that are created for open enrollment. Obviously, that's a huge barrier that prevents people from getting the eligibility they need to enroll in coverage with APTC. So we're excited about this. And then after we run this process during auto renewals, we will be conducting monthly income verification checks with quarterly wage data. And so every month, an individual with a household with an income data matching issue will have their information run through this database to see if we have new information that will allow us to automatically verify their income. So we're really hoping that this allows us to, again, automatically verify customer income and get them on their way. If for open enrollment, we will still be utilizing Equifax as a secondary data source as well. That's also run in concert with the IRS check. We anticipate being able to roll off of that check over time, so that we're utilizing IRS data and then data from the Department of Labor and Industry. This should reduce customer hassle and save money for our operations at the same time. So very excited about this partnership with the Department of Labor and Industry. I will now pass it to my colleague, Rachel Hess.
Good afternoon, everyone. The next new feature that we're going to discuss is voter registration. Currently, effective a few weeks ago, about 2 weeks ago, Pennie applicants will now have the option to register to vote within the Pennie application when they are submitting an application, a brand new application, completing a renewal, or updating their address within our system. There will be a new optional question that states, if you are not registered to vote where you live now, would you like to apply to register to vote here today, which will be located within the sign and submit page. And it will be offered to the primary applicant only, who is age 18 or older and also attests to being a U.S. citizen. You can see the screenshot there on the right-hand side of the slide. That is current display of what it looks like today in the system, of that optional question there, and the selection yes, no, or they can select that they are already registered where they live at now. You can see it is at the very end of the sign and submit page, located at the very bottom. There is a Learn More button there as well that applicants can click on to learn more, a little bit more, some disclaimer language there in reference to the voter registration question. So in the scenario where if an applicant selects no, or no, I'm already registered where I live now, there will be no additional voter registration information displayed to that customer. If the applicant does not answer the question, they skip it for whatever reason. Again, it is optional. It will not be a required question to move forward with the application. If they do not answer it, however, Pennsylvania voter registration law does require us to send them voter registration information via their preferred contact method if they skip the question altogether, just to, give them a little bit more information or the option to register to vote. Also, as a note, I know we don't get very many paper applications, however, they exist. The paper application will also include the same question displayed here, as well as follow the same logic, however the applicant answers the questions. Next slide, please. So then another screenshot here to the right. If the applicant selects yes and answers the question and says yes and submits their Pennie application, a complete voter registration application icon will appear on the eligibility screen next to the Go to Dashboard, as you can see there in the screenshot. This is exactly what it looks like in the system today. So once they say yes, they hit submit on their regular Pennie application. This is the first screen that they see, is their eligibility summary. And then once the applicant clicks the icon there at the bottom, all applicable voter registration questions will be presented. And then upon completion, the information is sent electronically to the Department of State to complete the processing. If the applicant, for whatever reason, they just submitted their Pennie application, their eligibility results are there, maybe they change their mind and they don't want to complete it at that time, they can proceed straight to their dashboard. And if so, that complete voter registration icon will no longer be displayed within the eligibility screen. So again, even if they say yes, they change their mind, they don't feel like doing it at that moment, what have you, they can go straight to their dashboard, shop for their plan, etc. Next slide, please. So once, again, at that point, then, if the applicant chooses to complete the voter registration application by clicking the icon, all of the required voter registration application questions will be presented. These are the standard, all of the standard voter registration application questions that any one of us would be required to answer when applying to register to vote. This is just a screenshot of the first couple here, but it's about a page. It's not very many. And then there are the radio buttons to answer yes, no. Some are mandatory, some are not. Once the applicant submits that information, again, like I said, it is sent to the Department of State to complete the validation and the processing of the actual voter registration and any other information they may need. Any follow-up information, any signature that may not have been able to be captured, whatever the case is, Department of State is going to be processing the actual voter registration application. Any correspondence regarding the processing of a customer's voter registration application will come from the Department of State. Their voter registration card comes from them. We don't have anything to do with that. And then any other additional voter registration questions or status inquiries should be directed to the Department of State. And again, that information will also be displayed on any correspondence that the customer gets regarding their voter registration from the Department of State. Next slide. So what does this mean? Basically, when brokers and assisters are submitting applications on behalf of the applicant, obviously they'll be required to ask the optional question, just like any other questions within the Pennie application, and record the answers selected by the applicant. If that applicant does say yes, the broker or assister would then be required to ask and record all of the corresponding voter registration information after and only if and when the customer says yes, let's complete that voter registration application. Or if they skip it, obviously there's no more action needed, and then they can go right to their dashboard and shop for a plan or look at their eligibility and things like that. But basically, it's just an additional question that is optional, like I said, that brokers or assisters would be required to ask on behalf of the customer.
All right. Thank you, Rachel. We do have some questions around the labor and industry income questions. So I'm going to pass it back to David to address some of those.
Yeah, thank you. So a couple questions around our utilization of the self-verification form. We're still going to allow that. However, the customer we're requiring that the customer submits a written document indicating their income, the same as we have now. We're no longer allowing for verbal attestation of income, just so that we have a paper trail should we need one. But so we're still going to utilize that. What we do expect is that having access to quarterly wage data will and the monthly cadence that we're able to process people through it will automatically verify more people. Right now, IRS data could be up to 2 years old. Equifax data is point in time. So having monthly runs, individuals having the monthly opportunity to have their income verified, I think will hopefully eliminate some of the need for them to take an action on their part. So we fully expect that will happen. I did see a couple of questions on 1099 employees, things like that. We're pretty much this process depends on the data that Pennsylvania employers currently send, so it's not going to cover everyone. I believe it does cover 1099 employees. I'm not 100% sure on that, but it covers the vast majority of people working in the Commonwealth. So again, especially for people whose income fluctuates month to month, quarter to quarter, this is probably going to be a benefit for them, and this will allow us to kind of piece together their income throughout the year, which we expect will add up to what they have projected for themselves on the Pennie application, but it might not be what the IRS has. So we do expect this to be especially beneficial for people whose income changes, maybe month to month, quarter to quarter.
Thanks, David. I want to keep things moving just in the spirit of time, and we're going to move over into the operations side of the house, and I'm going to pass it off to Ken Hetzel.
Thanks, Chachi. Good afternoon, everyone, and welcome. My name is Ken Hetzel. As Chachi said, I'm an operations business analyst for Pennie, and I help co-manage the Pennie Contact Center. So we're sharing an overview of our contact center updates for open enrollment 2026. Pennie has invested considerable time, energy, and effort in preparing the Pennie Contact Center for the open enrollment period. Our preparations actually began at the start of the new year. So with respect to staffing readiness, we'll focus our attention on the 4 bulleted points below. New contact center operations staff. Pennie has committed to hiring contact center management expertise that strengthens and supports our vision for improving all aspects of contact center operations. We're vigilant in our ongoing efforts to evolve and improve the consumer experience in the immediate moment and for the future. Here's just a few examples of the hiring that we've done. This demonstrates our commitment and how we're building out our management team to bolster our bench strength. The Pennie Contact Center has added a new senior quality assurance manager and a senior training manager. Also, Pennie added an eligibility specialist and a contact center business analyst, as well as insurer, assister, and broker business analysts as well. These additions will expand our capability as we have a heightened mission critical focus on quality, not just during open enrollment, but all year long. Innovative OEP playbook for Pennie CSRs. Pennie has created a comprehensive open enrollment playbook, a reference tool detailing the most impactful topics such as EPTC and final rule regulatory changes, along with the voter registration application enhancements that Rachel just went over. Positioned as a top-down resource for the entire contact center team, the playbook is designed to empower CSRs so they can locate important and relevant consumer information quickly during their calls and chats. Standardization of procedures. Pennie's commitment to streamlining operational processes enables CSRs to be more efficient. And this standardization effort has translated into increased staff productivity, removal of redundant steps, and measurable task performance, both in point of contact interactions with our consumers, but also within our back office ticketing work streams as well. Now, this is a cultural continuous process improvement initiative undertaken by the Pennie Contact Center. It doesn't end when open enrollment is over. It's our year-round pledge to excellence. OEP CSR training on EPTC, final rule, SEPs during open enrollment. Open enrollment CSR training actually began in earnest in the late spring of this year, inclusive of new CSR staffing ramp-ups and a tenured staff refresher training with an intensive emphasis on EPTC and final rule consumer impacts. Now, taken together, these 4 points illustrate our staffing preparation and readiness. Next, let's move our attention to the next 4 bulleted points, top to bottom, under process and reporting. Enhanced workflows. Pennie has designed, developed, and deployed an operational automation strategy that has yielded more efficient workflows within our ticketing processes, which has decreased processing and turnaround times. Improved complaints, processing, and visibility. Pennie recently implemented an enhanced complaints handling process that has improved response times and resolution significantly. We're very proud of this. This has been a success story for us so far this year, with the results reflecting a marked improvement from 2024. Call disposition additions. Pennie has created additional call and chat interaction dispositions that have been added to our telephony system for CSRs. This enables them to better identify calling trends and patterns as to what our customers need, in addition to the reasons why they are calling. Finally, quality assurance scorecards and performance briefing. Pennie has implemented revised QA CSR scorecards that better evaluate our consumer experience vision with a very rigorous accounting-based scoring methodology. This supports the balancing of accuracy and consistency of answers given to our consumers, allowing for improved CSR feedback, behavioral corrections, and reporting. Now, combined, these last 4 points and the previous 4 provides a high-level view of our improvement progress and underscores the contact center state of readiness for a successful 2026 open enrollment. Close out, if we can move to that last slide. Thank you so much. So I'm just going to close out the contact center portion with just a quick friendly reminder. We encourage all of our Pennie certified assisters and brokers to call our dedicated support line for whatever they need help with. That's 844-844-4440. And Chachi, I will turn it back over to you.
Thank you, Ken, fellow member of the Cue Ball Caucus. Great job with those updates. And I just wanted to remind folks, this is being recorded, and we'll be sharing the recording of this, but also these slides themselves. And for updates, because things are moving very quickly, just want to remind folks that it's very important that your email is updated within the system, because that's the email that we pull out to email any updates as they're coming through. So it's very important. If you're looking for a call to action, just make sure that the email within the Pennie system is up to date, because that's what we're kind of pulling out to email any system or any system updates or any policy updates or anything. That's where we we pull the email from. All right, so moving more to specifically what I was talking about is those application updates. I'm going to pass it off to Robert Cothey of Pennie team.
Good afternoon. We're going to head over some of the highlights of the application updates. This is certainly not a comprehensive list of everything that the system has been improved to do, but about the voter registration, we've already seen 30 or so folks register to vote using the application system. So we're hoping that during open enrollment, those numbers will climb and more of our folks in Pennsylvania will get themselves registered. We're also now presenting the ineligibility reasons to the consumers. So if for some reason they do not qualify for APTCs or they don't qualify for Medicaid, then we're going to present those reasons to them as part of their eligibility notice and let them be aware of why specifically they got the eligibility determination they received. And as David mentioned earlier, we put through some system enhancements to remove DACA recipients from the eligible lawful presence list. And those folks also have had coverage removed. So that is one of the updates this year. What I want to do is, as folks are being considered by Medicaid for acceptance, that can take anywhere from 2 to 4 to 6 weeks for them to do that determination. We made a system change that allows them to keep their subsidies, their APTCs, while that determination is going on. And then another Medicaid improvement, we're reevaluating the whole population of Pennie in the renewal cycle to make sure that we don't miss anybody that could potentially be Medicaid eligible. So that process actually is under review right now, and we're running those auto renewals. So if one of your customers happens to qualify now for Medicaid, or we believe they will, we'll send their application over to DHS and let them evaluate them. We added a few things on the assister and the broker screens. We added the license renewal date and the denied and withdrawn certification statuses for agencies. And we've also added the unique assister ID field. One thing your consumers are going to notice is that we're going to be requiring them to go in and update or confirm their communication preferences once per year. You've probably seen this in other applications or websites for other organizations where they want you to periodically confirm these are the correct contact preferences. It allows us to, points given earlier, make sure that when we're sending out notifications that we're sending them to the right places, and that way people have an opportunity to read them and react to them. We're also implementing, or did implement, a one-time passcode. So if you have a consumer that has a broker currently or an assister and they want to designate someone else, absolutely their right to do that. What will happen is the system will send them a one-time passcode so that they can confirm that this is a change they want to make. So that's something new. It's designed for protection for the consumers, and that was implemented this year. On the assister side, we've added the ability for you to enter notes in about the household, allow you to keep some annotations of what you discuss with them or whatever notes you need to keep on that household. And then in our consumer search directory, we are now displaying contact numbers for brokers and assisters. That way, if somebody does a search, finds a broker near to where they live, they can pick up the phone and call them right away and set up a meeting for them to potentially enroll. The last one we're going to bring up is continuous eligibility. So once a child is accepted into either Medicaid or CHIP, We're not going to move them back and forth. We're going to leave them in that program. Usually provides the most coverage for the best price. And so we will give them continuous eligibility from the time they're accepted for 12 months. Again, kind of an abbreviated list of all the enhancements that have gone in this year, and I'm going to reiterate what's already been said, which is please make sure your email is up to date in the system so that you can continue to receive our monthly Pennie certified checkup emails. Having said that, I'm gonna pass this back to Chachi.
Yeah, before you go off mute there, Robert, there is one question from Laurel here. It says, are notes, can Pennie assisters access those notes? It could save them time in explaining complicated situations.
Yes, they will be able to access the notes, and they're specifically on the assister screen so that the assisters can input them and maintain those for their customers. I hope
Excellent.
that answers your question. If not, I'd be happy to try to give you greater detail offline.
Thank you, Robert. And thank you to the policy team, operations, and the contact center team. This is going to be a challenging open enrollment, so I just want to acknowledge, thank you for all of your efforts in preparation and throughout open enrollment as we get going. Now we're going to jump into our open enrollment communications. And for that, pass it off to my colleague, Kelsey Cameron, our marketing and communications manager.
Awesome. Thank you. Thank you, Chachi, and good afternoon, everyone. So yeah, this first slide, we're just really going to talk about the enhanced premium tax credits communications and what we kind of have done and have planned coming up. So this is all assuming that they do get expired. This will be the kind of the communications moving forward. If they get passed and extended, we will be, as mentioned earlier, we will be communicating with you guys first and foremost what that means and what we'll plan to do then moving forward with our customer communications. So towards the end of this, at the end of open enrollment, we really would have been touching communications with our consumers 38 times over 6 channels regarding any kind of open enrollment or EPTC communications, which is 2 times more normal than we'd normally do throughout open enrollment. So that's really just showing how much more communications we'll be doing because of these changes. So we're really going to be combining multiple touch points, letters, emails, text messages, outbound calls from our customer service representatives, system notices, reminders. We're really working to protect our customers' trust with us and reduce any confusion, and really making sure that they're taking action during open enrollment. So, so far, we can just kind of give an update where communication status is for the enhanced premium tax credits. This past July, well, I can even go back farther than that. In May, we sent a postcard out to all customers. We did send that as an awareness for you guys as well. In July, we started mentioning the enhanced premium tax credits expiring in our monthly Pennie checkups. So like we do the Pennie certified checkups to our sisters and brokers, every month we also do send one to our enrollees, and that is called the Pennie checkup. So we started mentioning the enhanced premium tax credits to them in those monthly checkups. And then in August, we did send out a mailer, which really was very high level information about the enhanced premium tax credits. All that information can be also found at pennie.com/cost. We've really been pushing that webpage to our customers. It's the customer facing webpage for that. And then in October, we plan to send our notices, more regular emails about enhanced premium tax credits. We'll start an outbound calling campaign here in the next week, and then also sending text messages. And then in November, there'll be the auto renewal notices and eligibility determination notices as usual. And then, so that's really our enhanced premium tax credits communications overview. And then the next slide, we can get into open enrollment communications. So this is kind of outside of enhanced premium tax credits. So using our normal tactics of emails, the same thing, outbound calls, text messages, mailers, and like Devin had mentioned earlier, our really messaging to all enrollees is that they really must come in this open enrollment period and update their information and then shop for plans. So we will be encouraging them in all communications that plans and prices change every year, especially this year. And due to recent federal changes, there will be an increase in penalties if income information is not up to date. So we're really, really honing in that all enrollees really need to come in and make sure their application is all updated and then also shop for plans. So just to break down a little bit of open enrollment communications, for you guys, we'll be sending an email here soon with our stakeholder toolkit, which I'll talk about in a later slide, and then the awareness of the notices coming to customers shortly. We'll also keep sending our monthly certified checkups throughout open enrollment, and there's where you can find any awareness updates or status updates on anything within the system. Open enrollment, communications webpage. So we have done this in the past where our toolkit email will also include a link to a webpage that we created that will kind of have all customer communications on there in a table. So it's a one-stop shop, so you can see maybe what customers are going to be getting throughout open enrollment. And then we'll also send all of our stakeholders the reminder of the important deadlines, and then any ad hoc updates if there's any kind of issues or anything that assisters and brokers need to know right away. We'll be sending those throughout open enrollment as well. So current customers, we'll be sending them a open enrollment is coming email, and then also an open enrollment has arrived email. In the notices themselves, we created a little insert that kind of explains what we talked about earlier about how every enrollee needs to take action this open enrollment period. And then we also do kind of have our specific customer communications to those specific audiences of those who maybe need to take action or have awareness throughout open enrollment. Those haven't changed much from years prior. So that's really like if we need permission for them to have financial savings or the failure to reconcile, we'll send emails about that. Those who were not auto-renewed for some reason, we send emails that they need to come in and enroll, and all of the catch-up runs for an awareness. If they're in a bronze plan and it would benefit them to buy up to a silver plan. And then kind of newer this year, all current enrollees will get the 5-day deadline reminder. So we send countdown reminders in emails up to both of those deadlines. And then potential customers, same as years prior. So we do email and reach out to those who have submitted an application but did not enroll, and same thing with an opened application don't enroll. As long as we have their permissions to contact them, we reach out to them on a weekly basis, reminding them that this is open enrollment and this is the time to take action. And they also get the deadline reminders as well. And then we also do have our CRM contact list, and that is community partners that we do send high-level open enrollment messaging throughout open enrollment to help get the word out in the community to help us get some more enrollments. So so that's kind of a very high level of open enrollment communications. And then next slide. Now I'm just going to go through our owned, earned, and paid media tactics for open enrollment. Kind of owned, we kind of just covered that. Customer communications, email, outbound calls, text, mailers, postcards. Our stakeholder toolkit we will be sending here towards the end of this month, and that will have updated collateral to be used throughout open enrollment. We will be updating Pennie.com, our website, with any need to know information, but then also making sure it's open enrollment and call to action, as well as our social media. We'll have a social media campaign throughout all of our social media sites throughout open enrollment with that call to action. Earned media will be hosting press conferences and distributing press releases to the press around the beginning of open enrollment and around those important deadlines. We also will continuously be doing media interviews and pitching to the media to make sure that we're always in the media coverage, and especially any updates surrounding the enhanced premium tax credits. Next slide. And then paid media and our creative campaign, we're really going to focus this open enrollment period on some different target customer personas, really kind of looking at the young invincibles and then also the financially vulnerable, as well as large and medium metropolitan markets, and as always, statewide coverage. Our tactics really include paid search and social media. So we'll also be bringing back the social media influencer campaigns, TV and radio. We actually have 2 different TV spots this year. One really focuses in on that you're worth protecting messaging that we've done in the past. And then we have another one that's really the call to action that we talked about to our current enrollees, but then also new enrollees. Just really make sure you're updating your application or applying, and shopping for all plan options to stay covered for 2026. We'll be doing streaming video and audio, transit advertising, lifestyle advertising. That includes like advertisements in pharmacies and hair salons, Steelers and Eagles radio ads, print ads in various community publications that are also in various languages, billboards, and event sponsorships. So creative-wise, our main key messages are really still that you're worth protecting messaging. Open enrollment is here, calling out all the important deadlines, and really focusing that, Pennie has quality health coverage with a ton of benefits, free professional support, help available in preferred languages, and then protection from low quality plans and scams. And that Pennie is that trusted source and the official PA marketplace for health coverage. We're kind of going to stay away a little bit from the low cost messaging this year with all with the enhanced premium tax credits maybe going away. Might not be the best to call that out specifically, but Pennie still has tons of benefits that we can message. Next slide. And then this slide is just our toolkit, again, is coming soon. So this will have updated collateral for 2026, and that also includes updated collateral for Spanish. We do have other languages as well for some specific collateral that you can be found on pennie.com, agency.pennie.com/toolkit. And then we also have social media content samples in there, as well as talking points for open enrollment. But we also have our enhanced premium tax credit talking points, and then the new rule and bill changes, all talking points will be linked in those as well. So everybody has all the information for all the different kind of changes this open enrollment period available to them in this toolkit. All right, and then I think that is my last slide. So Chachi, I'll pass it back to you.
That is your last slide. So thank you for rolling through that. That is an insane amount of information. And for a very small team, definitely been cranking it out. So I just want to say, appreciate the efforts there. And there was one quick comment from Mark saying that wouldn't it be great if we had something in the advertisement that would say, contact an agent, contact for help in our ad that's speaking kind of directly to the enrollee and to those that are uninsured. It definitely mentions that there's free help available. So didn't want to just specifically call out a broker or specifically call out the assister, but saying that there is free help available, that that help is of no cost to the consumer. So speaking of the assisters, jumping over to our outreach and education department, which is led by our manager, Allison McKee. Take it away, Allison.
Hi, thanks, Chachi. Thanks for joining us today. Thanks for hanging with us through lots of information in a very short amount of time. I'm going to close us out in terms of content. And what I'm going to do is give you a really high level update on our outreach efforts. As Chachi said, I'm Allison McKee. I'm the Outreach and Education Manager here at Pennie. So you can go ahead to the first slide. And the first thing that I'm going to talk about is our new assister network, which is launched this summer. And this model really has two primary goals. These goals were driven by consumer data and feedback. So lots of credit to my colleagues in Marcom for getting that information to help us know to really focus this on increasing awareness of Pennie. Obviously, the more people who know about Pennie, the more that are going to come on board and the more that can tell their friends to come on board. And then the second goal is really to get help available in more places. So assisters and brokers both play such a key role in making sure that folks can get enrolled. People have different preferences and different methods that they would seek to find support. This is another way that we can get help in different places across Pennsylvania. So a really quick overview of this model. We have a new lead contractor, their Health Market Connect, and I did put in response to someone's question earlier, the press release that goes over some of this information that I'm going to cover in a little bit more detail, but they're really overseeing the whole network, subcontracting out with regional organizations. They're working with the Pennie team to make sure that the strategy is aligned, that we're collaborating, that resources are getting well utilized, and they're organizing all the training and reporting and efficiencies. Then at kind of this regional organizational level, we have an organization who's in charge of a specific set of counties. And what they're doing is they're developing a strategy for that region that aligns with Pennie's broader vision, but they're bringing a local approach. So our hope is that their knowledge of their local communities, the connections with their local communities can help kind of bring Pennie's work into that community at a different level. They're also, of course, driving enrollment assistance and outreach efforts, and then they're helping us continually grow what we call partner entities. So partner entities are this idea of community-based organizations that really assist us in our work. They're helping by handing out flyers, hosting events, sometimes even also becoming assisters. And there's a whole list of different types of organizations that could become partner entities on here. But if you take a look at the graphic, it's really kind of this this hub and spoke model of a lead contractor, regional orgs, and then all these partner entities kind of surrounding. You can go ahead to the next slide. And this is exciting. This is our beautiful map of the great state of Pennsylvania and what our regions look like. You'll notice they're pretty closely aligned to PID's insurance rating areas. The big difference is we have 8 versus their 9. So we combined regions 1 and 2. And then I also have listed on here which organizations are the lead for each of our identified new regional organizations. So many of these organizations we've worked with regularly. Some were actually involved in our previous iteration of our sister network, but all of them are wonderful partners to Pennie. We're really excited for the different types of expertise that they bring and how they're going to be able to infuse that into the communities that they're serving. And then the next slide. This gets us into at a very high level what the strategy looks like for outreach for this open enrollment. So at the Assister Network regional org level, they're really going to be focused obviously on enrollment efforts. They're going to be building these on the ground connections, and they're going to be getting resources in more places across the Commonwealth. So that might look like, you know, on the ground work of getting, someone mentioned in the Q&A, we're developing a new scheduler calendar method for people to get appointments. It might just be getting Pennie resources in more places, but being out in the community. They're also going to be doing outreach and enrollment events across all those newly defined regions and using zip code level data to help kind of identify and guide them to the highest level of priority. And then kind of the Pennie outreach and education strategy. So the folks of us that work for Pennie and also do this work are focused more on educating key partners around the changes. So Kelsey just talked about how we communicate via email to all those key partners, but we want to do more than that too. We want to be able to provide education sessions, make sure that they're aware of what the changes are, make sure that they know that brokers and assisters are available to help and that they're a free resource and all the wonderful work you all do. We want to talk about value of coverage, importance of shopping, and then we also want to focus on expanding the base and the capacity of all those referral partners. So that's going to look like education sessions, meeting with stakeholders, developing relationships. And again, the goal is that those two strategies kind of hold hands and boost each other up. So that's the highest level view. That's it for me. Mine was short and sweet. And I'll turn it back to Chachi.
Okay, we're just going to wrap things up now. I appreciate everyone's attendance. And again, we'll be sending the PowerPoint deck and this recording out to the email that you registered with and or the email that is in the application itself. So thanks again. Please be aware of more communications that are coming, especially as especially with what ends up happening with the enhanced premium tax credits. And if you need any help, please call the phone number that is specific for brokers and assisters that is on your screen right now, which is 844-844-4440. So thank you again for everyone that attended, and we'll be in contact soon. Thanks again. Have a great open enrollment.